Let's go over Unit 5, States of Consciousness. First, get into the stages of sleep. This chapter is kind of divided into two topics. You have the sleep stages and dreams, and you have the other states of consciousness like intoxication, or drugs, and how chemical substances affect the brain. So starting with the sleep stages, it's important to note that there are 4 different stages of sleep. There are really 2 types of sleep that you can have. You have REM sleep, which is rapid eye movement sleep, and then you have non-REM sleep, which are the first 3 stages, or I should say the 3 stages that are not REM cycles. REM cycles are much shorter, and they happen in bursts in between the sleep stages. So as you progress through the stages, really REM cycle is the 4th stage that you enter into, if you want to look at it that way. So the difference between an alpha brainwave, which is awake, slow, relaxed brainwaves, to delta, which is stage 3, or deep sleep, the deepest level of sleep and relaxation that you can be in, restful, physical, restorative sleep, then you get into a REM cycle. So non-REM stage 1 is the transition between wakefulness and sleep. You're only in stage 1 for about 5 to 10 minutes. That's when you're starting to drift off. And then you slowly progress into a deeper level of sleep. And then you have non-REM stage 2. Body temperature drops and heart rate begins to slow. The brain begins to produce sleep spindles, which are those bursts of energy that you can see on EEGs. It lasts approximately the next 20 minutes. And then if you continue uninterrupted to progress into sleep, you will go into stage 3, which is delta wave sleep, which is the deepest sleep you can get into. Your muscles relax, blood pressure and breathing drop, and your body is really relaxed. Once you progress through those first 3 stages, then you get your first REM cycle. So again, this is assuming that it's uninterrupted. You progress from being awake, stage 1, stage 2, stage 3, which is deep sleep or delta wave sleep, then you hit a REM cycle. REM cycle is important for restoring brain function. It's how the brain regenerates its energy and its neurofunction. So the brain becomes active during REM sleep. The eyes move back and forth, which is why it's known as REM sleep, or rapid eye movement sleep. But the body looks relaxed and mobilized. The brain is functioning and firing, though. This is also where dreams occur, and that's important to note that dreams occur during REM sleep. If you look at how the night progresses, there are several different charts that are very similar to this one. I like this one because it's clean and easy. It comes from a health website. You look at the top left corner of being awake, then alpha wave brainwave activity as you get into stage 1, then non-REM 2, non-REM 3, and really this is kind of interesting. They have the stage 3 broken down into an even deeper level of sleep of stage 4, but there's really not 4 stages that sleep researchers refer to. There's really just 3. From being awake to being in your deepest level of sleep. But then you can see as time progresses you hit a REM cycle, and the interesting thing to note from this chart is that as the night progresses, you can see you stop falling into stage 3 and you continue to just go from stage 1 and 2 and then hit a REM cycle, and then stage 1 and 2, then you hit a REM cycle, and about the 5th hour of sleep you stop even going into really much further into stage 2. You just kind of bounce back and forth between REM cycle and stage 1 into stage 2 very lightly, and then back into a REM cycle. So the longer that you stay asleep, the more REM cycles you hit in a shorter period of time. So in fact, as sleep progresses, you get less deep sleep, less stage 3 sleep, and you get more REM cycles. So when you look at rapid eye movement and non-rapid eye movement, or non-REM, REM is known in the textbook as paradoxical sleep because you look to be really, really relaxed, but in fact your brain is very active. And again, if you wake up during a REM cycle, that's when you remember your dreams because you are fairly conscious. You're not entirely conscious, but you're in a light level of sleep. It would be easier to wake them up during a REM cycle than it would be during a deep sleep. Stage 3, say. Disorders of sleep, people who have problems going to sleep, problems staying asleep, or even problems waking up when they go to sleep. One is insomnia. can't sleep or wake up. Insomnia can be caused by various psychological factors. It could be temporary, it could be stress related, it could be health related, or it could be that you're not producing melatonin at the rate that you are supposed to produce it. Narcolepsy is the opposite of that. It's the brain, the hypothalamus produces melatonin at inappropriate times, and then you would have a hard time controlling when you go to sleep and when you don't. So in other words, it's not based on that blue light or daylight. There's a part of the nucleus there's a nucleus in the hypothalamus known as the SCN, which is the suprachiasmatic nucleus, and what it does is determines when it's daytime, and then a communication is sent from the hypothalamus to the pineal gland, which is the part of the endocrine system that creates melatonin. So if narcolepsy is inappropriate amounts of melatonin at different times, then you get sleep apnea. Sleep apnea is not because of melatonin. Sleep apnea is because of pressure on the chest cavity. It's a sleep disorder where people actually stop breathing at some point during their sleep cycle, and then their brain starts to kind of panic with lack of oxygen, and then they are woken. They become awake. And the difficult thing about sleep apnea is obviously it's going to disrupt the cycle of sleep. It's not just the amount of time that you get sleeping, it's the fact that you progress through stages. And when you're constantly being awakened and then you go back to sleep, then you kind of restart the cycle all over again. So you don't get restful sleep, you probably don't get REM cycles. So sleep apnea is a very problematic thing. As you can see the diagram there, you need continuous pressurized air in a CPAP machine that forces oxygen so that you don't stop breathing, you don't stop the oxygen supply to the brain. Night terrors, again, that's one of these problematic things that people think that they are one thing when in fact they are something else. Night terrors did not refer to nightmares. Night terrors refer to people who wake up and subconsciously maybe they were having a nightmare, but they appear to be terrified. Their bodies are shaking and moving, but it happens in the deepest level of sleep. There's not a dream that you're consciously aware of when you wake up. Sometimes they might move or fidget or even get up. But the interesting irony is that if you remembered a dream that you were having and it was a nightmare, it would be during a REM cycle, so it was not a night terror. A night terror happens in the deepest level of sleep in stage 3. Sleep talking and sleep walking, that's again something that happens in deep sleep, and that's something that is not really controllable. It may be genetic. It tends to not really be affected by environmental factors so much, unless it was like extreme intoxication or something like that, in which case it would not be a disorder. But that's again happening in the deepest levels of sleep. Dreams are interesting because they are highly theoretical. I mean, we know they happen. We know that there is a subconscious mind. They're known as the hallucinations of the sleeping mind. And what's interesting is that, as you can see from this dream depiction, there's an incongruity there. There's a lack of logic. Train tracks that go off into the ocean. That there really doesn't seem to be a need for logic while you're sleeping and in a sleep state. A lot of times dreams are suggested to be a necessary part of brain function, filing away memories, repairing neural connections, or just a natural part of the brain getting its rest during a REM cycle. Hypnosis, this is Sigmund Freud's original pathway to the unconscious of what he believed was if you put someone in a deeply relaxed state, you can tap into their unconscious mind because the ego would not be guarding them or protecting them from vulnerabilities. So hypnosis, social interaction between a hypnotist and a subject where suggestions are made about perceptions, feelings, thoughts, or behaviors, and the idea is that with a relaxed mind, you can tap into the subconscious and you can get at the things that are below the surface. You can make post-hypnotic suggestions. Those are actions that you instruct people to do while they're under a state of hypnosis, and then there's some kind of trigger that will cause them to do it after they get out of the hypnotic state. Dissociation, that's a term that you would see in the abnormal psychology unit also. This is a split in your consciousness or dissociated state. That's where your brain and conscious awareness are in one sort of state of mind or one place, and your actions and your behaviors are separate from that. So you're doing something that you're not consciously aware of, and then you become aware of it later on. Drugs. So the second half of this chapter is to look at how drugs affect the conscious mind. These various states of consciousness, obviously being awake, asleep, or intoxicated. So there's only certain states of consciousness that a person can be under. So drugs are any chemicals, whether they're pharmaceutical grade or medicinal in use, or whether they are natural. Doesn't matter. We're talking about foreign substances, agonists and antagonists, that change the perceptions of the moods or the actions of neurofunction themselves. We call them psychoactive. So any chemical that enters the bloodstream that alters the mind is known as psychoactive. It activates the mind. So some vocab for drugs: tolerance. It's the diminished effect after continued use for a drug, similar to dopamine. Once you have a drug effect, chemically speaking, there's a lot of times and instances where you would need more, a higher level of that drug to get the same desired effect. Withdrawal. Withdrawal is a chemical agonist dependency side effect that happens when you take a drug that you are chemically addicted to, meaning that your brain relies on that foreign chemical as part of its normal homeostasis or homeostatic state, we should say. So for instance, caffeine, with your caffeine addiction, if you go without caffeine, you're going to get withdrawal experiences because your brain is seeing an imbalance in the chemicals. It has grown dependent on a foreign chemical for its normal homeostatic function. So discomfort, distress when you discontinue use of an addictive drug. Now that's different than like a physical dependence. A physical dependence might be the actual effect from the drug. It may not be that your brain is chemically addicted to the effects of the drug. It may be that you have grown very dependent on how they make you feel. That's that physiological need. Psychological dependence is more like the things that you've grown habitually to depend on. Those dopamine addictive behaviors, things that you do just because you need the feeling of that. It's not so much that you would get a chemical withdrawal or experience withdrawal, but that you have a psychological dependence on a drug because that's where that's kind of your escape, what you go to when you're experiencing a certain trauma or emotional state. So psychological dependence is different. That would be treated with therapy, whereas a chemical or physical dependence would be treated with other chemicals or medication. You would have to go into rehab and you would have to kind of cycle down off of that. So maybe the difference between like alcohol addiction as maybe being a psychological dependence compared to something like cocaine or heroin, which would be a physical dependence. Addiction obviously would be the compulsive craving for something. Even when there are adverse consequences, you still crave that, and you are kind of out of control in terms of your chemical dependence. So as requested, I created a much more comprehensive chart here of the chemicals in the brain. And even though this is from Unit 3, it's kind of aligns well with understanding how foreign substances affect the brain, to know which chemicals in the brain are affected in various ways. And so I will upload this document also so that you have access to it for closer review and reference. But if you just look at some of the chemicals that I put there, you have glutamate, which is a neurotransmitter that activates neurons, causing the brain to communicate or to fire. It's essentially the stimulation of the brain. Glutamate causes the brain to fire. When you have too much glutamate, you get headaches, migraines, anxiety, or even a panic attack, and that comes from the overstimulation of the brain. If there's not enough glutamate, then the brain simply won't function. You get an overall lack of neurofunction. The largest known agonist or synthetic supply of glutamate would be gluten, and that's actually bound gluten. I'm sorry, that would be free gluten, not bound gluten, and that's known as this monosodium glutamate, which is MSG, which is a commonly used preservative in foods. So if glutamate stimulates or excites the brain, GABA is the molecule that inhibits the brain, which slows the brain down. So you need something to cause the brain to be alert and function, and you need something to sedate the brain or calm it down. So GABA has a calming effect. It is inhibitory, whereas glutamate is excitatory. So they are opposites in that way. They kind of affect the brain in opposite ways. If you had an oversupply of GABA, that would be a sedative effect. That's something that would cause you would slow you down. Lack of awareness, slower, impaired neurofunction, or sedation. If you had an undersupply of GABA, not enough GABA, you would have the same effects as too much glutamate. You would have headaches, migraine, anxiety, and panic. What increases GABA in the brain would be whole grain foods. That actually causes a sedative sort of effect on a smaller level, especially things that are rich in soy. Magnesium-rich foods, those will all increase GABA levels. There are other chemical agonists like sedatives that you take. Those would mimic the effect of GABA on the brain and calm the brain down, the central nervous system down. And there are stimulants that they can give to people who overdose on sedatives, and that will bring the brain back. It will kind of cause it to function again. ACH, or acetylcholine, is a molecule released by motor neurons, and the purpose of ACH is to control muscular function, but it also has a role in keeping you alert and in control of your faculties as well. It aids in memory formation and in learning. So ACH is a complex molecule. It's affected very highly by alcohol, which is why you get dual effects from alcohol intoxication. You get not only physical coordination effects, but you also get memory formation and cognitive function that gets impaired by intoxication from alcohol also. So alcohol affects ACH, which has multiple functions, both muscular and in memory formation. So overstimulation of motor function, if you had too much ACH in your system, you would have tremors, muscular shaking, or even seizing of muscular tissue. And the opposite of that would be true if you had not enough ACH. You would have a lack of coordination, a lack of control of your muscles or motor function, and if you had no ACH, you would have no muscular control at all. You would have paralysis. So again, the more alcohol that you have in your bloodstream, the more it's going to block the ACH muscular function and hand-eye coordination that you have. Nicotine stimulates ACH, so do Alzheimer's drugs. They mimic the effect of ACH on the body, or on the brain specifically. There are antagonists that are used specifically to paralyze overactive nerves, things like Botox, which is botulism, that people use to kind of paralyze the nerves in their face and things like that. Serotonin we talked exclusively about. That's mood regulation, emotional function. Too much serotonin equals mania. Not enough serotonin would be depression. Known agonists and antagonists would be an SSRI, which is a selective serotonin reuptake inhibitor, and those are antidepressants. Oxytocin we discussed also, social trust and bonding. Too much oxytocin would be mania, irrational, unfounded trust in others, or intense bonding. Not enough oxytocin would be irregular mood swings, irritability, lack of connection with other people, almost to an apathetic or sociopathic level. Probably the most famous known agonist for oxytocin is Pitocin, which is used in labor and delivery to speed up the contractions and delivery process for birthing mothers. Dopamine we talked about, primary molecule involved in motivation for action in the general reward system. Dopamine is involved in an addiction. Too much dopamine would be panic, paranoia, diminished response to risky behaviors, so in other words, a lack of fear. Activities and increased levels needed to feel satisfied. So again, you have to have an increasing amount of dopamine to feel satisfied. And a lack of dopamine would be a lack of motivation, even to perform routine tasks, a lack of muscular regulation, even contraction or seizing of the muscles, or even on an extreme level, if you had no dopamine, you would have paralysis. THC is a dopamine regulation agonist, which is the active ingredient in marijuana, and what it does is blocks a cannabinoid in the brain called anandamide. Agonists include ADHD-controlled substances such as Adderall, and they work on dopamine receptors. In fact, an abuse of Adderall actually strips out dopamine receptors in the brain, which is why it's very dangerous to abuse Adderall, because it can have massive addictive effects, behavioral effects, personality changes, and things like that. So you want to always use those controlled substances as they're directed. I know a lot of times there are prescription drugs that are available on the market, and so people think that they are safe to take and abuse recreationally, but you have to be very careful with how drugs affect the brain, what parts of the brain they affect, what receptor sites they affect, what chemicals and molecules they affect. And Adderall and other ADHD drugs are similarly effective because they act on dopamine receptors, and they do so because you need focus, you need motivation to stay on task. Cortisol, of course, is the stress response. It's a stress alert for a danger or perceived threat. Too much cortisol obviously would be panic, anxiety, hypertension, fight or flight arousal or sympathetic arousal, and the opposite is true for a lack of cortisol. And then, of course, steroids, things like prednisone, would increase cortisol levels. It helps your body fight infections and foreign bodies. But also, you can increase cortisol levels or stress and anxiety levels with really sugary foods and protein-rich lean meats. So if you eat too much of an unbalanced diet or you eat too much junk food, you're actually contributing to the anxiety in your brain because you're increasing your cortisol levels. Histamines are activated in response to allergens, foreign bodies that can cause allergic reactions, and so this is part of the sympathetic fight or flight response. It is an allergic reaction. If you have too much histamines being released by the brain, you can cause things like itching, increased alertness and sympathetic nervous arousal, which is a stress response. An undersupply of histamines would be drowsiness or calmness, lowered ability to fight allergens. So when you take allergy medication like Benadryl, a lot of times you get a drowsy side effect, and the reason for that is because it's blocking histamines, and histamines help keep you alert. Antagonists such as antihistamine allergy medications, especially things like Benadryl. Endorphins. Endorphins are pain blocking. They block pain signals. They also cause a euphoric feeling, that positive emotion, that rush that you get, this intoxicated high feeling that you get from various activities or even chemical substances. Your brain does like an endorphin rush. It's a very positive experience and feeling, and so endorphin mimicking drugs are very dangerous and very addictive because the brain wants to experience the feeling of endorphin euphoria. So a lowered level of endorphins would be an acute awareness of your pain. So people who have addiction to painkillers, when they are not on their medication, they have blatant awareness, acute awareness of their pain and their soreness, and it's something that they have a hard time not focusing on, which is why controlled narcotics like painkillers or opioids are very addictive and very hard to avoid addiction from. When you get into norepinephrine is also homeostatic. It's part of the fight or flight response. It's alertness to cue you into how to respond to a threat. Increased norepinephrine would be physical tension. Your muscles are ready, and your mind is highly alert to avoid a threat or fight a threat. And a lack of norepinephrine would be sympathetic nervous response or even apathy. So if an increased amount of stress response like cortisol for norepinephrine would be similar to anxiety or panic, which is fine in short spurts. But if you have lots of norepinephrine and cortisol, then you are panicked all the time, and that's anxiety disorder. So when you look at how anxiety is treated pharmaceutically, you get things like SNRIs, which is selective norepinephrine reuptake inhibitors, and that's going to diminish the amount of norepinephrine in the brain, effectively calming the nervous system, taking the edge off and calming the body down. So you have agonists that will ramp up norepinephrine, things like amphetamines or stimulants. Again, Sudafed is an example of an amphetamine, meth and things like that, cocaine, caffeine. But you also have blockers. SNRI blockers would stop norepinephrine from being transmitted in the brain, so it would fight the anxious effect of norepinephrine. Drug classifications, now that you kind of know what chemicals in the brain are responsible for and what they do, you look at what depressants do. Depressants will inhibit neurofunction, stimulants will excite neurofunction, and depending on which parts of the brain or which neuropathways they affect, so things like dopamine in the reward pathway or endorphins, which affect the euphoric feelings in your, and the pain blocking stimulants, depressants, or sedatives, things like that. So next it'll be Unit 6, which is a difficult unit for a lot of people because you have various types of learning. You have classical conditioning, operant conditioning, schedules of reinforcement, and so we'll go into some detail on that. So stay tuned for Unit 6, and that is the next video that we will do.